Hello, I'm Lacey,
Hi, I'm Heather.
Hi, I'm Jennifer.
and this is our presentation on the pros and cons for collaboration with other professionals. We're going to start with a brief overview and introduction to collaboration with other professionals, define some terms that we use throughout the presentation, discuss some pros of collaboration, barriers of collaboration, wrap up our main points, and then discuss some frequently asked questions at the end. First, the overview. Successful interprofessionalism is typically founded on communication and comprehension. There is a higher quality of care for clients across all cultures due to collaboration, and there is a higher advanced healthcare services due to collaboration. Interprofessionalism, it can be beneficial when collaborating with others, but also it is ineffective. There can be ineffective professional collaboration. Differences in terminology can cause confusion, and opposing views on sensory interventions can cause conflict. Some defining terms we use throughout this presentation. IDT is an interdisciplinary team. It is a process by which professionals from different disciplines effectively engage in collaborative practice that is fostered by establishing a foundation of shared ethical standards and values, and by embracing a vision of an inclusive culture. An inclusive culture is one that's open to respect and welcomes team approaches by embracing the contributions of each member in the professional team. This can include exchanges of information, clarification of values and preferences, openness to options and preferences, and actual choices. OT is an occupational therapy. It's a branch of healthcare that helps people of all ages who have physical, sensory, or cognitive problems. It helps with barriers that affect a person's emotional, social, and physical needs, helps kids play, improve their school performance, and aids in daily activities. They help to develop fine motor skills, improve hand-eye coordination, master basic life skills, and learn positive behaviors and how to manage anger and frustration. SLP is a speech language pathologist. They evaluate a person's communication or swallowing abilities. They diagnose underlying problems, develop personal treatment plans, provide therapy, and maintain records to track a person's progress. They teach someone how to speak clearly, exercise muscles used to speak and swallow, and help to increase the words that an individual can say and understand. They improve sentence structures and provide education to parents and families. ABA is applied behavior analysis, a therapy based on the science of learning and behavior, increases language and communication skills, improve attention, focus, social skills, memory, and academics, decrease problem behavior, and can be adapted to the unique needs of the individual. It can be provided in various locations and uses a one-on-one teaching strategy and a group instruction. BCBA is a board certified behavior analysis. This is a graduate level certification in behavior analysis. Professionals certified at the BCBA level are independent practitioners who provide behavior analytic services. Some ABA terms used in this presentation is DRO, which is differential reinforcement of other behaviors, DRI, differential reinforcement of incompatible behaviors, and DRA, which is differential reinforcement of alternative behaviors. Next, we're going to get into the pros of collaboration with other professionals.
The pros of collaboration with other professionals are based on the idea that when two or more professions work together, they are able to achieve common goals. And they often also, therefore, solve a variety of problems and complex issues together. This term, at its ideal, is interprofessionalism. When interprofessionalism is successful, there is an increased quality of healthcare delivery, there's improved client health outcomes, and enhanced work life of care providers, strengthened partnership with professionals, families, and stakeholders, optimized cost of care, more effective and positive client outcomes, improved personal and professional growth, better effects on youth as well as their families' mental and physical health, accessibility and quality of care, which is also part of ethics, and we will see. We've also supplemented with the ethics code to all of these, to most of these. There's shared scope of practice. There's an increase of shared goals across fields that help shared populations such as individuals with ASD. There's multiple fields focused on building skills and behavioral regulations. An example of this is that when there's collaboration, both fields may be helping building life skills and independence, such as feeding, dressing, and hygiene. The visual to the right shows the steps for becoming a competent and interdisciplinary team member that factors in towards successful interprofessionalism. So the first stage, as you can see, it's called the unidisciplinary training. So early stage of training. Then you evolve to a professional. You start implementing new skills that you learn. Then you become an interdisciplinary team member. So you embrace the specialty area of expertise that you're in. Each profession has their own strengths. Another pro for collaboration with other professionals is that each profession can share their strengths with each other. The visual shows that the strengths of speech language pathologists and BCBAs. SPL is strong in diagnostics, whereas behavior analysts are strong in data collection strategies. This gives the opportunity for collaboration. So the speech pathologists can learn from the BCBAs on behavior management, and the BCBAs can learn on developmental norms from the speech pathologists. Another pro of collaboration is that both professions get to use similar techniques and structures to achieve common goals, such as the common technique of breaking down a skill into smaller parts for learning and manipulating the environment for teaching. There's also improved outcomes for learners. All needs to be focused on and met with multiple professionals working together. There's improved supports in place and easier for client and families to benefit from integrated services. There's an increase in knowledge as a practitioner, collaboration on development of appropriate goals. Just another example is collaboration with OT and BCBA together. It helps to increase the research and evidence-based practices used in the field of OT. The last pro that we will touch on is that in which collaborations between fields means exploring research within each other's practices can lessen the duplication of techniques and principles and also expand knowledge of effective strategy used in other fields. So we shared values across professions. And here's just a quote from a reading, is that collaboration leaves all parties feeling valued and appreciated for their expert knowledge and for their contribution to the team effort.
Next, we're going to get into the barriers that are faced when working with other professionals.
So for the barriers, we're going to first touch on the interprofessionalism. We can see barriers when it comes to time restraint, also with lacking of administrative support, which might look like connecting with the time constraint of if your administrative is expecting you to have meetings and meetings and not give time for that time to be collaborating with other professionals. This can cause a real issue in terms of trying to form those relationships and those collaborations. There's also issues with communication, and there's minimal collaboration training in many companies. There's also limited professional guidance. And then when we go into the ineffective professional collaboration, there can be hostile competition between fields. There can also be communication breakdown issues, and there can also be strained professional relationships. There's some families that may become confused about how to integrate these recommendations from their ABA consultant for verbal behavior targets with conflicting recommendations from their speech language pathologist consultant for their language intervention targets. So this can be a big barrier for collaboration if there's confusion on both sides coming from the parent. This is where that collaboration could really benefit so that it's not confusing having different views from two different professionals. There is also differing technical terms used in ABA and SLP. They have different terms when relating to similar strategies. So an example of this would be an SLP may talk to families about commutative temptations, while in ABA professions, they would talk about their motivating operations. There's also ABA terms that might be misunderstood, which would look like DRO, DRA, DRI, functional assessments, functional analysis, verbal behavior, problem behaviors, complexity of oral speech, and language development. So again, these differences in terminology can be a large barrier when it comes to collaboration between professions. The differences in terminology cause a barrier when it comes to understanding, which can prevent the engagement between professions. ABA terminology has been stated as being off-putting when using jargon that other professions may not understand. So this has been described as abrasive, harsh, and unpleasant. A study found that in general, people did not find ABA terms to be user friendly, and the terminology is not universally known across the professions outside of the ABA field. So this visual kind of shows what we would like it to look like versus what it actually is. So on the left, this shows what the ideal overlap would be in terms of that collaboration and how the overlap of scope of competence and scope of practice has kind of like a larger overlap. That's what we would love for it to look like when it comes to collaboration with professionals. But we can see that on the right, an SLP's scope of practice and scope of competence only slightly overlaps with a behavior analyst scope of practice and scope of competence. So this smaller portion of overlap makes that collaboration even more important. Newer school psychologists are less familiar with outside providers in the community, which causes there to be less likely engagement in interdisciplinary collaborations. There's only 22% of school psychologists that reported collaborating with others. This may be due to the reported difficulties with sharing information in terms of privacy laws. The lack of collaboration with audiologists is particularly problematic because of the hearing related concerns in youth with autism. This is important due to the psychoeducational assessment process. And here we related that to a couple ethics codes, which would be code 2.12 would be considering medical needs. And also code 3.12 would be advocating for appropriate services. So these collaborations are really important when it comes to a behavior analyst following the ethics code. Individuals with developmental disabilities are not given enough support in planning for or in facilitating the transition to adult care due to differences in perspectives when it comes to the different professions. A delay in autism services, as research has documented a lack of coordination and communication between healthcare service providers. And here we related this to the ethics code, which relates to providing effective treatment, um, also considering medical needs, and consulting with other providers. Another barrier can be opposing views on sensory interventions. So there's controversy over sensory integration theory due to the lack of empirical evidence. In occupational therapy, they relate uncommon responses to sensory experiences to difficulty regulating sensory information, which has led sensory interventions used within the OT field. Um, so this difference is that since there is not empirical evidence, it would not be utilized in the ABA field. But for occupational therapy, they do not always base their interventions off of evidence based practice. There are also different views on data collection and ways of measuring progress. This relates to the ethics code about providing effective treatment. And in OT, they do not always utilize evidence based practices as stated. While this is part of the 7 dimensions of ABA, an important aspect of being a BCBA. Occupational therapists can also choose treatment plans without research backing up the treatment. And it depends on how effective it is, which contradicts ABA since there's not research backing it up. BCBAs follow a professional ethics code, which emphasizes the use of scientifically validated and effective treatment procedures. So this difference in practice could cause confrontational conversations about the use of evidence-based treatments. There's conversations and concerns can lead to the feeling of a lack of mutual respect for the opposite field, or a feeling that one field is more superior. These feelings lead to some conflict and questioning of practices that can lead to a lack of collaboration in the future. There's also the reputation of the field. So many professionals outside of the field of ABA do not fully understand what ABA is. And ABA has a past reputation of not creating a plan for generalization. Other fields commonly view ABA as failing to consider the client's wants and interests. Some literature has even suggested that occupational practitioners avoid utilizing ABA principles. Often, there is no training for collaboration offered by BCBAs, and they're not taught strategies for resolving conflict during collaboration. So you can see here that we have a common goal of creating meaningful, socially significant changes to the lives of people that we serve when you're looking at the ABA field and the occupational therapy field, that we only have slight overlap.
Okay, next we're going to summarize the main points discussed. So successful interprofessionalism can lead to a higher quality of life for clients of all cultures and advance healthcare services. Successful interprofessionalism is a process by which professionals from different disciplines effectively engage in collaborative practices that is fostered by establishing a foundation of shared ethical standards and values and by embracing a vision of inclusive clinical culture. To achieve successful interprofessionalism, communication is key. Professionals are able to understand the different languages of each field if we're communicating what they mean back and forth to each other. An example is those in the ABA field can learn to use and understand terminology used in speech, and BCBAs can learn to use terminology that is not considered work jargon. Competent and healthy work environment. Professionals are not only well equipped to administer protocols or tasks, but they also are able to teach others how to perform them. Higher quality of life for clients of all cultures. Independence is the key to a higher quality of life. The reason that collaboration occurs is to help a client achieve optimal benefits by using obtainable resources. Providers are able to support clients with their goals. Providers share this common interest. In the case of professionals working with clients with disabilities, the ultimate shared goal is for the clients to have an increased quality of life. Advanced healthcare systems accomplish mission goals. Every profession has their specific mission goal when collaboration occurs with individuals. Individual professions are able to achieve their missions and propel advancement in the field. Innovation. With advancement of professional fields, the availability for investment in innovation is a result. This visual is showing kind of the progress for the client, the problem solved, and the pivot points, and how the family collaborates with everyone as an individual, and we can collaborate with each other to make a all-inclusive treatment plan. And finally, the Q&A.
So we have some frequently asked questions within the field of ABA. We will start with what happens when professionals cannot come to an agreement.
So after professionals cannot agree on a certain technique to administer to a client, so in general, so how to unite the fields together, in essence, then for sharing common goals of techniques and all that, as I mentioned, then individuals have the right to follow through with their own ethical standard and practices without having to communicate any longer with the other field. So speech pathologists can stick strictly to their own use of words, of terminology or practices, while the BCBA can also do the same.
All right. So the next question would be, what is an example action plan of two or more professions collaborating?
So an example of two professionals collaborating together could be that of a BCBA collaborating with a speech pathologist within a clinic base or even in home, just back and forth communication. But in regards to like in clinic base, say a BCBA could create a goal of having a client label or tagged 50 words daily, and the speech pathologist during their appointment with the client, they could also get on board with showing the client 50 visuals and then having them label. So they're both working for the common goal of expanding a client's verbal behavior by labeling items that they may find in their environment. So working on the same behavior there.
hmm what is a solution when professionals are able to collaborate but parents are not?
As BCBA's professionals, we work for the best interest of the child. The parent has the last say as to whether their client even receives ABA or not, however, in the first place. As professionals, we must find the best way possible to help and support families as outside services, yet it is up to the parents.
Okay. And who is taking lead in each profession regarding collaboration?
So, although the RBT is the right hand of a BCBA, and they spend most of the time working directly with the client, whether providing service in home or at clinic, the BCBA is still the one reaching out to other professionals, such as the licensed occupational therapist. This is also an ethical code, which is 3.06, that states behavioral analysts arrange for appropriate consultation with and referrals to other providers in the best interest of the client. So it is their duty to do that, and not like the underhand, which is like the RBT. So the licensed.
All right. Thank you for answering those frequently asked questions. And we just wanted to say thank you for everyone who listened to our presentation. And we hope we were able to teach you about some of these pros and cons when it comes to collaboration with professionals. So hopefully you can learn from some of these barriers going forward in the field when you're trying to work to collaborate. And now we will provide our references used for the PowerPoint. Thanks.